The advice is mostly the same. The Danish follow 10 healthy living tips and addend recommendation for pregnant women, which the Dutch do as well. The big difference is that the Wheel of 5 is realized and more specific. The 10 tips aren't which might be hard for some groups. Then for the additional recommendations, there are some small differences.
The Dutch recommendation is only for 1 cup of coffee a day. In the Danish, the recommendation is maximum of 3 cups of coffee a day. In Dutch, you're allowed to eat 2 or 3 pieces of licorice. By the Danish, the maximum is 50 grams of licorice. The Dutch recommend 25 grams extra meat for the iron. Danish advise to use supplements to gain iron. The Dutch value food safety more, and the Danish value the environment and physical activity too. The Dutch value weight before the pregnancy, Danish only during the pregnancy. Danish recommend specific supplements for calcium. Danish specify recommendations for medication too.
As us, but just like a presentation of Okay, so we are studying nutrition and health, and like the field of study or our focus is health promotion and prevention, and we're in our third semester out of, what is it, seven? Seven, yeah, so just almost halfway through. Okay, and we're going to be talking about pregnancy and the different dietary tips and restrictions that you have for a woman in her second month. Okay, and the 4 important aspects is the diet, it's dietary supplements, it's physical activity, and then it's also focused on smoking and alcohol and medications and stuff, and what is okay and what are the restrictions and things like that. So first we have the dietary recommendations. In Denmark we have something called the 10 dietary tips, and the 10 different ones is that you have to eat a variety of food and you don't eat too much and you have to be physically active. And then you have to eat fruits and vegetables and eat more fish, and you have to choose whole grain products. And when choosing meat, you have to choose the lean meats and the lean cold cuts as well. And you have to choose low fatty dairy products. You have to eat less saturated fat, and eat food also with less salt and with less sugar in it as well. And then you have to drink water. And then these are just for the everyday person, the 10 tips. And then we're going to get into what is the recommendations for someone who is pregnant.
Yes, and everything the mother eats, the fetus also receives. Therefore, you should follow the 10 dietary tips, but there's also some special recommendations for pregnancy. And one of them is eat fish several times a week. And that's because fish is healthy, because it contains healthy oils and it's good source of vitamin D. Avoid large predatory fish, and that's because pregnant women and nursing mothers should not eat cuts of the large predatory fish since they have high levels of mercury. Predatory fish are, for example, oilfish, swordfish, shark, and tuna. And don't eat liver if you're pregnant. Liver and cod liver oil can contain large quantities of vitamin A, which can harm your baby. And don't eat for two. It's because in Denmark we have recommended about amount 1100 kilojoule if you're pregnant. So if you eat too much, you will have too much in weight and you can't lose some afterwards. So don't eat for two. And then follow the recommended weight gain intervals. If you eat more than you need, the extra calories will probably be deposited as fat. And don't drink more than 3 cups of coffee or 300 milligrams per day. It can give you a higher risk of abortion. And then there is a special thing about licorice. You can't eat more than 50 grams daily. That was the dietary recommendations. And then there is some supplements who's also very special for the pregnant women. And the first one is you have to eat 400 micrograms folic acid daily from pregnancy as planned and 12 weeks into the pregnancy. You also have to eat 10 micrograms vitamin D daily through the whole pregnancy. Half a liter of milk products per day or a supplement or 500 milligrams calcium daily through the whole pregnancy if you don't eat the milk products. The last one is iron supplements. It's also relevant from week 10 of your pregnancy. You need 4 or 50 milligrams of iron per day. And in the bottom you can see a diagram and it shows the importance dietary supplements you have to eat when you're pregnant.
Yeah, and then we have the alcohol, smoking, and medications recommendations, which is to avoid medications that may impact or harm the fetus, because the fetus may absorb and be affected by some medications. They can be harmful to an unborn child. And to avoid smoking, because it has a risk of premature labor and low fetal weight. And this can happen if the mother smokes or even through secondhand smoking. And at last, to avoid alcohol, because the fetus also absorbs the alcohol through the placenta and is harmful, which is harmful to the fetus. The recommendations for the physical activity is exercise daily throughout the pregnancy, which strengthens the muscles and bones and therefore provides a good conditions for a healthy pregnancy. But it is important to avoid heavy lift and jumping, and also high intensity or high heart rate, because it can stress the fetus.
Okay, and lastly, we have just some other factors that can also have an impact. So we have like environmental impact.
Okay. If everyone's ready. Okay. Before and during the pregnancy, women lays the foundation for a child's health. A good, safe diet helps a child to a healthy start. During pregnancy, a child is completely dependent on its mother's diet and food reserves. And for pregnant women, this means a healthy diet is eating according to the Wheel of 5, which I just explained to you a little bit. I'll show you a picture of it later. The Netherlands Nutrition Center also has additional recommendations for pregnant women. These recommendations apply from the very moment that the women decide to try to become pregnant. In the first weeks of pregnancy, women are often unaware that they are pregnant. Yet that period is actually particularly important for the child's development. The dietary recommendations that the Dutch Nutrition Center gives focus on providing the best possible diets for the health of the expectant mother and their child. Most dietary recommendations are derived from the 2006 Guidelines for a Healthy Diet. They are supplemented by more recent recommendations from the Health Council of the Netherlands. This is regarding vitamin A, D, folic acid, alcohol, preconception healthcare. These recommendations include a special focus on being overweight before and during pregnancy. For pregnant women, a healthy diet means eating accordance to Wheel 5. And the daily recommended intakes of food for pregnant women are the same as those for women between the age of 19 and 50. However, the recommended intake in the category of meat and processed meats, fish, chicken, eggs, and meat substitutes is slightly higher because women require more iron during pregnancy. Thus, the following recommendations are stated. From at least 4 weeks before conception to 8 weeks thereafter, take 400 micrograms of folic acid daily. Thus, starting taking folic acid supplements from the very moment the decision is taken to try to become pregnant until 10 weeks after the last menstruation. During pregnancy, a woman should take 10 micrograms of vitamin D daily. Do not take any supplements containing vitamin A or eat any liver or liver products. Eat more products from the categories meat and processed meats, fish, chicken, eggs, and meat substitutes. About 125 to 150 grams per day, rather than 100 to 125 grams per day, which is the usual recommendation the Wheel 5 gives. You should eat fish once a week, preferably oily fish. Drink no alcohol from the very moment that the decision is taken to try to become pregnant. Do not make a conscious effort to eat more than you did before the pregnancy. Overweight women should try to lose weight before becoming pregnant so that you can start the pregnancy at a healthy weight. During the pregnancy, do not diet in an attempt to lose weight. And the food safety recommendations, as I'm describing later, should be followed. There are also some additional dietary recommendations that are required. For example, in the event of gestational diabetes mellitus and of extreme nausea and vomiting. The Netherlands Nutrition Center advises women who suffer from morning sickness to eat and drink something before getting up in the morning and to eat regularly and drink plenty of fluids. There is no scientific evidence to support these recommendations, but they do appear to work in everyday practice. That's why they are actually recommended. In addition, women following a vegan or vegetarian dietary pattern require additional recommendations. With respect to their vitamin B12 intake, for example, women who follow a vegan dietary pattern would be well advised to consult a dietitian. Then we've reached the food safety recommendations. There's a lot of do's and don'ts. And the recommendations concerning food safety focus on foodborne infections and on the intake of harmful substances. Recommendations are designed to minimize risk. Many of the food safety recommendations are offered as precautionary measures because some products may cause harm to the unborn child. Therefore, the most important ones are that women should avoid the following. They shouldn't consume raw meat, raw and smoked fish, raw egg, raw sprouts, cheese made from raw milk and raw milk to avoid the risk of contamination with bacteria like Listeria, Toxoplasma gondii. Do not consume predatory fish like swordfish, shark, and tuna, neither canned or smoked. Products containing liver or liver in general, alcohol, herbal pills, and gourd lime to avoid the ingestion of harmful substances. For some products, it may be advised to take no more than a certain amount. First one is to have a maximum of 1 cup of coffee per day, a maximum of 2 times fatty fish per week, no more than 1 or 2 cups of fennel and anise tea, no overuse of culinary herbs, and a maximum of 2 or 3 pieces of licorice a day. And here on the picture you can also see a food guide for pregnant women. That means you should eat oily fish, lean meats, a lot of vegetables, and you shouldn't eat anything raw really, or anything smoked. But that's it really, the recommendations Nutrition Center of the Netherlands gives. Do you have any questions?
I don't think so.